check for the brachial pulse. +2 on both. We would check for the femoral, but we're going to check for popliteal. Large legs. All right, +2. And then we're going to do the posterior tibial. Sorry. +2, and then the dorsal pedialis. I'm just going to do one at a time on this one. +2. And do the foot. +2. We're also going to look at the fingers and the toes. We're going to see if there's any clubbing of the fingers that would indicate any respiration issues like COPD. So we're going to make sure that the capillary refill is less than 3. She has a brisk return. All right, and we're going to check your toes. All right, same. It's less than 3 and it's a brisk return. All right, we're also going to check for the strength. If you can just move up your arms for me. I want you to push against my hands. All right, so it's a +5. Do it in the other direction now. Push down. Beautiful. 5 out of 5. Squeeze my hands. I want to make sure it's symmetrical. And then if you can do it with your legs, can you just push outward? All right. And then if you can push up against. Beautiful. And then I want you to just lift up your feet for me, and I want you to push down on both of my hands as if you're like driving a car. Beautiful. So 5 out of 5 for upper and lower extremities. Can you lift up your hands? All right, so now we're checking for range of motion. And then whenever we stand up later, we'll do your legs. We're also going to check for the reflexes, and we'll check the carotid artery a little bit later when we get to the neck. All right, so we're going to check for the brachial thoralis, so it's going to be +2, and then we have the actual brachial. All right, +2. I'm going to do the tricep now. Relax your arm. Relax it. Just hang on my hands. All right, +2. And then we're going to repeat on the other side. +2. Do the brachial. All right, +2. And then again, just relax the arm. We're going to do the tricep. All right, +2. I'm going to ask you to just move back just a little bit so your legs can dangle just a tad. We're going to check for the patellar. All right, it's a +2. To the other side. +2. And then we're going to check the Achilles and the posterior plantar. +2. We're looking for that foot to make that downward motion. +2. Beautiful. All right, now we're going to start with the head. We're going to look at the head. Have you had any head injuries before? No. All right, so now we're going to inspect the scalp. We're going to see if there's any lesions, any moles, any scarring, and that the hair is evenly distributed in the head, and I don't see any flaking or anything either. Now we're going to bring it back to the face. If you just look at me, can you smile? Can you puff up your cheeks? Release. Lift up your eyebrows, and you can bring it back down. And I want you to open your, just kind of smile and then clench your teeth down. All right, so we're checking for cranial nerves 5 and 7. She did opt out on cranial nerve 5, which is whenever you do the cotton ball and you look for a brisk eye closure to make sure that that's intact. Do you have any issues with TMJ?
No.
All right, so I'm just going to ask, I'm going to put my hands on your jaw, and I want you to just open, close your mouth. We're looking for a clicking. All right, beautiful. Can you just close your eyes? We're going to touch for sensation. So just tell me when you touch. Just say now.
No. 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 No.
All right, so cranial nerves 5 and 7 are intact. We're going to move to the ears now. Okay. Do you have any issues with your ears? Do you have any ringing in the ears?
No.
Do you have any pain on the mastoid process or the tracheus? That hurt?
No.
All right, we're looking on the external part of the ears. We'll look at both of them before we even begin, looking for any moles, lesions, any redness, or any scaling also. Now we're going to check for the tympanic membrane, the inner part of the ear. We're going to pull back and up and then tip this upward a little bit. The tympanic membrane, it's visualized, that's gray pearly. There's no discharge, there's no drainage, and bony prominence are intact. We're going to move to the other ear. And tympanic membrane, same findings. It is gray shiny. There's no purulent discharge. Bony prominences are also, they're visualized. All right. So that is cranial nerve number 8. Lastly, do you have any issues with your hearing?
No.
Okay. So we're going to do a hearing test. It's the Renin test. You're going to tell me which one is louder, number 1 or number 2. Okay?
2.
Okay. And now we're going to do the other side. 1 or 2?
2.
So that is a normal finding that the airspace is louder. All right, so that's all cranial nerve 8. We're going to move to the eyes. Do you wear any contacts or glasses?
No.
Okay. So I'm going to start with cranial nerve number 2, and then we're going to move into cranial nerves 3, 4, and 6 to look at the extraocular motors of the eyes and the way they move. So I'm going to stand at about 6 feet, and I want you to close your right eye, and I want you to tell me which line you can read, like the smallest line. Just read from.
LTFPH.
Oh, wow. Okay. So it's 20/20 vision that eye. Can we do the other eye?
LTFPH.
Okay. And then can you do it with both eyes and read that same line?
LTFPH.
Okay. So it's 20/20 vision. All right. So I want you to just look at me, and I want you to cover, you can cover the right eye if you'd like. We're going to check for the peripheral vision of the eyes. Okay. So you can close the right. That's fine. Just tell me when you see the fingers. Okay? Tell me when.
I did.
Okay. Now do the same thing on the other eye. All right, tell me when.
Yes, I can see them.
Okay. Now we're going to inspect the eye. We're going to look at the eyelashes. You make sure that they're evenly distributed. Make sure that there's no lesions, no crusting. We're looking at the sclera, which is white. And then we're going to look and pull down for the conjunctiva, which is pink. Do you also have any sinuses issues?
Yes.
All right. Are they swollen right now? We're going to touch the frontal sinuses and then the maxillary. Any tenderness?
No.
Okay. So now we're going to move to the eyes. Now just look at my finger only, and I'm going to bring it to your nose, okay? We're just checking. All right. So we're making sure that the eyes are able to accommodate and they focus and they start to go together, and we're not showing any lazy eye, and we want to make sure that the eyes, that the pupils are able to constrict so that way they can see the finger. Now with just my finger, I want you to look just at my finger without moving your head, and we're going to check the extraocular motions, okay? So just. Alright, so Perla is intact. Now we're going to visualize the inside structures of the eye. So I want you to just look at my left ear. Okay. So the red reflex is noted and symmetrical in the right eye, and there was no blurry margins, and there was no sharp disc noted, and the blood vessels were noted. So now we're going to repeat it. Look into this ear. Okay. Red reflex also noted and symmetrical, and same findings. Blood vessels were visualized. There was no blurry margins, and the disc was not sharp. So. Do you see the eye doctor regularly?
Yes.
How often do you go? Once a year?
Once a year.
Okay. Now we're going to move to the nose. Have you ever broke your nose, or do you have any deviated septums?
No.
Okay. And you had mentioned you suffer from allergies. Do you have any drainage right now, or have you had any issues right now with allergies?
No, not right now.
Okay, so now we're going to inspect the nares. So they're pink. There's no drainage at this time. And are you able to close one nostril and just breathe in? And then the other one? Okay. Any difficulty with breathing?
No.
Good. Okay, so now I'm going to move on to your neck. So I'm going to listen to you for bruits really fast. I'm going to listen with my bell. And if I heard a bruit, I'd be concerned about an aneurysm, because a bruit is an obstructed blood vessel. But I'm only going to use this one at a time. Oh, could you hold your breath for me? Okay, good. I do not hear one there. So I'm going to go ahead and do this side with the bell. Okay, good. I did not hear anything, which is exactly what I wanted to hear. Alrighty, now I'm just gonna palpate one at a time. Good, it's bounding. Now let me do this one. Yes, very bounding. Perfect, and they were symmetrical, so that's good. Now I'm just gonna look at your trachea. Could you swallow for me? Okay, good. It looks nice and even. It's not deviated or anything. If it was, I'd be concerned about like a collapsed lung or anything, but I'm not, so that's good. Okay, so now I'm just gonna take the time and look at my sheet. Now we're gonna do the back side. Do you feel comfortable just turning around for me without getting off the bed? Perfect. And would you put your hair up for me, please? Yeah. Thank you.
You've got a lot of it.
You do have a lot of hair. I'm very jealous. Perfect. So I'm just gonna go ahead and palpate your thyroid. So first, could you swallow for me? Okay. So I'm just gonna deviate and feel. Don't feel anything there. Deviate and feel. All right. Any pain or tenderness? Nope. Good. All right. I didn't feel anything there. I'd be concerned about something very bad, like a cancer or something, or an infection. But nope, you're all good there. Is it okay if I untie this? Yep. Cool. Thank you. So first, So first I'm just gonna start out with some chest expansion. Could you take a deep breath for me? Perfect. Thank you. My hands moved, which means you're nice and symmetrical, so that's good. That's exactly what I wanted to feel. Okay, so first I'm gonna listen to your lung sound. So we're gonna do 12 deep breaths. Every time I place my stethoscope down, I'd like you to take a deep breath. But if you need to take a break, please let me know. If you're feeling any dizzy or weakness, just please let me know. Could you bring your back towards me a little bit? Okay, good. You can relax. Switching to my diaphragm. Okay, and then we're gonna go ahead right now. Just gonna move your bra a little bit. Alrighty, then last one. Perfect, thank you. Alrighty, your lung sounds were clear. They were, I didn't hear any crackles or wheezes. They're normal breath sounds, which is good. So now I'm gonna go ahead and I'm going to percuss your back everywhere that I just auscultated. If you feel any pain, let me know, but you shouldn't. Okay, all good. I heard resonance, and that's exactly what we want to hear. If I heard dullness, I'd be concerned about a tumor, but I didn't, so that's good. Could you go ahead and lie down on the bed for me, please? Okay, I'm just gonna steal your pillow, but I'll give it right back. Okay, could you face the wall for me? And could you turn around and face me? Good. I don't see any jugular vein distension. What it would look like is just a bulging vein. That means a backflow of blood in the body. I didn't see any of that, so that's good. Okay, so now I'm just gonna go ahead and listen to your heart. Might be a little uncomfortable, so if you're uncomfortable at any time, just please let me know. And I'm going to start off by listening with the diaphragm. Sorry.
No, you're good.
Okay, so clavicle, space. Rib 1, space. Rib 2, space. Perfect. That's your aortic valve. So now I'm switching to the bell to listen for any murmurs. Okay, I did not hear any, so that's good. That was your aortic valve, so now I'm going to move on to your pulmonic valve, switching back to the diaphragm. Clavicle, space 1, rib 1, space 1, rib 2, space 2. Perfect. I hear big lobe dubs, and I did over there as well. Switching to the bell for any murmurs. Okay, I do not hear any. Excellent. Back to the diaphragm. Okay, so now I'm going to go find your herbs point. So I'm just going to go down a little farther. Rib 3, space 3. I'm going to go right here. Perfect. Big lobe dubs. Now I'm going to flip this around again. Back to the bell. Okay. No bruits or murmurs. Back to the diaphragm. So now, could I also loosen this? There we go. Perfect. Sorry.
You're okay.
Okay. So now I'm going to find tricuspid. So this is space 3, rib 4, space 4. Okay. Sorry. Perfect. Big low dubs. So I'm keeping the spot with my finger. I'm going to switch over to my bell. Okay. No murmurs or bruits. Perfect. Back to the diaphragm. Gonna find your last spot, which is your mitral valve. So I'm just gonna rib 5, space 5. Okay. So I'm just gonna go mid-clavicular. So I'm gonna go right here. Just gonna raise your bra up just a little without exposing you. Perfect. While I'm here, I'm going to get your apical pulse for 1 full minute.
Se procede a la higiene de manos. También la colocación de elementos de protección personal según corresponda el contexto. Se reúnen todos los materiales necesarios para el procedimiento. La enfermera pide al usuario que pase a la camilla y se recueste. Por consiguiente, pide también que se descubra la zona del abdomen. Dividimos el abdomen en 9 cuadrantes: hipocondrio derecho e izquierdo, epigastrio, flanco derecho e izquierdo, umbilical, ilíaco derecho e izquierdo. Para comenzar, auscultamos cada cuadrante. Esto se realiza antes que la palpación y percusión, ya que estas pueden alterar los ruidos hidroaéreos. Si los ruidos aumentan, el usuario está con indigestión, y si disminuyen o no, hay presencia de que está en estreñimiento. En este paciente encontramos un abdomen de tipo tabla. Luego viene el proceso de palpación. Se inicia con una palpación ligera que cubre las 9 regiones, identificando los músculos y sus características, y si hay zonas con existencia de dolor. Ahora se continúa con una palpación más profunda, indicando las zonas de dolor no precisadas. Luego se sigue con una percusión que también se realiza en cada cuadrante. Identificamos diferentes sonidos de matiz y timpanismo. Esta se hace con ambas manos. La mano dominante será la que percutirá. En el caso de la región inguinal, se inspecciona la presencia de masas, inflamaciones o hernias. En este caso no se realizó el examen de región inguinal debido al pudor de la usuaria. Ahora valoraremos la zona renal. Evaluando el patrón de eliminación urinario para luego realizar el examen renal, el cual consiste en ejercer la percusión con la mano en puño, identificando tamaño y presencia de dolor. Si el paciente presenta dolor, significa que hay una alteración en su organismo. Finalmente, en la región dorsolumbar es importante evaluar la simetría de la columna. Además, la distribución adecuada de las masas. Esto significa que el cuerpo no esté más inclinado hacia un lado u otro. Para valorar la columna, la enfermera debe observar si la usuaria se puede mantener de pie en posición erguida y además palpar la ubicación y dolor. En conclusión, en este tipo de examen segmentario se utilizan los métodos de exploración, de inspección, palpación, auscultación y percusión.